everyone, I'm Lila Abbate and thanks for coming back to my YouTube channel. I'm a pelvic health physical therapist and an orthopedic physical therapist, and I see lots of different conditions in postpartum women. So today I'm going to discuss cesarean scars. So a cesarean section is a cut at the lower part of the near the rectus abdominis, and you know, they're doing this in order to help save the baby and help save the mother, and it's urgent and important and necessary. So in order to promote good healing, any type of scar needs to get worked on. So the topic of, scar mobility and scar extensibility, of how well a scar can move, is something of importance. Any type of abdominal incision that you've had, any type of orthopedic problem, whether it's like, a knee surgery, a bicep tendon tear that has been repaired, every type of scar needs to move. There's connective tissue underneath, things need to move up and down. Then there's a muscle under there, and if there's a scar going through that area, the muscle's going to become weakened and it can't generate normalized strength. So as a physical therapist, I'm always evaluating scars no matter how small they are. So I wanted to talk today a little bit about a cesarean section scar, and I'm going to use like a demo on my hand about how to massage it. A lot of times they're uncomfortable, people then don't touch them, but you really should do the opposite. So once you've been past your postpartum time of maybe 8 weeks, because with a cesarean scar you want to make sure there's good normalized healing, you're able to then do what's called scar tissue management. I just use basic Nivea in the clinic. At home you can use any kind of cream. I'm just kind of using like a little dab on the skin. And then if I'm making believe that that's my scar, I can use that much or even a little bit less. So we're going to make believe that this is my longitudinal scar. So it's all the way at the bottom, right above the pubic symphysis. So you want the scar to have been healed. You don't want to start working on areas that look like there's still a scab that's there, or even a stitch that could still be there. So this is a clean, dried scar that just looks a little thick. So if it's sensitive to touch, you can just start doing very light little circles after you apply a little cream on it, and do clockwise circles, counterclockwise circles, all within that line. Then sometimes if the middle's too tender, you can just do the edges, and do the edges in up to down, and then sure enough over time you can be doing up to down throughout the whole thing, okay? Then you want to try to pick up your scar. Thank goodness I don't have a lot of excess hand skin here, but you want to be able to try to pick it up. Tissue has 3 planes. It has an X plane, like an X-axis geometry, Y-axis, and then you want to be able to pick it up in that Z plane of motion. So scars need to be able to move in all the directions. You're separating the skin from the underlying tissue, and the underlying tissue can have nerves and muscles. And if it's here down and it doesn't move well, it can cause the patient pain, but worse, it causes muscle weakness and dysfunction. So then you're trying to create that pliability between the layers. So you can work on all of that, and then you can then stretch it in the up direction. So with 2 fingers this way, you'd be lying there pulling it up, or you can be pushing it down. And then you're just trying to figure out, as if it were a clock, in what direction does it seem to be getting tight. If you're finding that it's just too uncomfortable for you and then you need someone to maybe do it to you, seek the care of a pelvic health physical therapist, or maybe have your significant other who could do it for you. Grab a neighbor and say, hey, I have a scar that hurts, can you help me out? And you would be surprised at the changes that you can have in pain, and maybe even some abdominal strength. So I hope that was helpful, and thanks for stopping by my YouTube channel. See you soon.